DMG's Icon is the first ever caries infiltration product. Caries infiltration offers a totally new treatment method for early caries lesions with non-cavitated enamel and a maximum radiographic lesion depth of up to the outer third of the dentine. Caries-related white spot lesions are not only a disturbing cosmetic problem, but are actually a visible early stage of a carious lesion. It is therefore reasonable to treat them at this stage so they won't progress. Caries infiltration offers an ideal treatment method. The positive effect of this treatment is that compromising white spots can be masked. It is very important that the affected enamel still appears intact on the surface and that no enamel breakdown can be detected. Before treatment, the teeth are thoroughly cleaned and any debris rinsed off. The treatment kit includes all main components needed for a successful infiltration treatment. Only a few additional accessories, such as a rubber dam, are required. The use of a rubber dam ensures absolute dryness, which is a requirement for the infiltration technique, which in turn complements a successful treatment. In the first steps, the affected hard tissue is prepared for the actual infiltration with a special HCl gel, which is applied to the affected area with one of the specially provided tips. A contact time of 2 minutes for the gel must be observed. The use of HCl gel ensures the successful removal of the surface zone of an early caries, which helps facilitate the infiltration process. After the activation time of 2 minutes, the pore volume of the incipient caries is accessible. An incomplete removal of the surface zone of an early caries will disturb the infiltration process. The acid gel is removed with a water-air spray and air-dried. Remaining water in the porous hard tissue will inhibit the penetration of the infiltrant and must be removed. This is easily done by rinsing the lesion with the ethanol solution provided. During this step, the possible future aesthetic outcome can be clearly observed. This solution is also removed with oil and water-free air. Once dry, the full extent of the caries is made visible. The infiltration process begins by means of DMG's specially designed application tips, which allow access up to the cervical margin. The specifically developed resin is applied slowly to the affected area in 2 steps. The first application of infiltrant is allowed to penetrate deeply for a period of 3 minutes. Excess is removed with a cotton roll and dental floss, and then the resin is light cured. This process is repeated, whereby this time the second resin application is made for only 1 minute. By successfully filling the defect with the infiltrant, the caries is stabilized and sealed and progression arrested. The optical change of the defect is impressive after the infiltration. The lesion's pore volume is now filled with a medium that has a similar light reflection index to healthy enamel so that the white spot can no longer be detected. After a successful treatment, the restored area is finished with fine polishing aids and the surrounding hard tissue is polished. A further advantage of this innovative treatment method is that it does not change in any way the anatomical shape of the tooth. Icon combines state-of-the-art dentistry with the patient's wish for drill-free treatment of their teeth in order to protect and preserve healthy tooth structure. A very satisfactory cosmetic result can be achieved in a single treatment sitting. All relevant treatment information is recorded in the patient pass. The treated areas are marked in the treatment record. The dentist enters the treatment date and the determined lesion for the patient's record. A follow-up appointment to verify the treatment success can be scheduled immediately.